Well, thank you. It is great to be back at the New York Academy of Sciences. A huge thank you to the Academy and the Newer Foundation for making this series possible. And this evening, we are delighted to kick off our new series, Unlocking the Unconscious, Exploring the Undiscovered Self. In the last few decades, there has been an explosion of interest in the nature of consciousness, both as a scientific problem, as we try to pinpoint the neural networks underlying conscious experience, and also as a philosophical problem, as we try to bridge the enormous gap between the physical stuff of our brains and the entirely non-material world of our thoughts and feelings. And the unconscious, strangely, has to some degree gotten lost in this discussion. I say strangely because Freud made the unconscious the centerpiece of his investigation into the human mind more than a century ago, and yet, at least the way I read some of the current scientific discussion, now I should point out I am not a scientist, so what do I know? But it's as if everything that happens in the unconscious is just fast and automatic, almost machine-like, as if this puppeteer that's yanking us around, but totally beyond our control and even our awareness. So far-reaching for sure, but perhaps not all that interesting. And yet, clearly our unconscious minds are profoundly important to us, whether we're trying to understand our dreams or where creative inspiration comes from, or why we get so bogged down in negative feedback loops. And even though we're desperate to try to get past all of this negative thinking, we often don't know how to make it stop. So we have a fascinating and complicated subject to unpack this evening, and one that has very practical implications. And we have a great panel to help us sort out these questions. So let me introduce our speakers. Heather Berlin is a cognitive neuroscientist and assistant professor of psychiatry and neuroscience at Mount Sinai School of Medicine in New York. She received her PhD from the University of Oxford and MPH from Harvard. She explores the complex interactions of the human brain and mind with the goal of contributing to improved treatment and prevention of impulsive and compulsive psychiatric disorders. She's also interested in the neural basis of consciousness and dynamic unconscious processes, and is a visiting scholar at the New York Psychoanalytic Society and Institute. Efrat Ginat is a graduate of the NYU postdoctoral program for psychotherapy and psychoanalysis. She's an instructor at the Institute for Contemporary Psychotherapy and a supervisor at the Fifth Avenue Center for Counseling and Psychotherapy. She also has a private practice in New York. Her work focuses on enhancing the understanding of complex psychotherapeutic processes such as affective communication, enactments, self-narratives, and their importance to therapeutic growth. She's the author of The Neuropsychology of the Unconscious, Integrating Brain and Mind in Psychotherapy. And George McCary is director of the DeWitt Wallace Institute for the History of Psychiatry, a professor of psychiatry at Weill Cornell Medical College, and an adjunct professor at both Rockefeller University and the Columbia University Center for Psychoanalytic Training and Research. He received his MD from Cornell University Medical College, completed training at the Center for Psychoanalytic Training and Research at Columbia. He maintains a private practice at Payne Whitney, and he is the author of Soul Machine, The Invention of the Modern Mind, and Revolution in Mind, The Creation of Psychoanalysis. Welcome, all of you. So, George, let me start with you a very basic question. When we use the words the unconscious, what are we talking about?
Well, it's a great question to start with, and you'll notice immediately when you think about the word unconscious that it seems to be a negative category, right? It's not conscious. So, in a way, to really understand the word unconscious in some depth, you have to start with the word consciousness. Now, consciousness started at a very specific time. For Locke, it was around 1680, and for Descartes, and they had a very specific idea. The mind had conscious experience. There was no such thing as mental experience that wasn't conscious. When Descartes said, "I think, therefore I am," that was what consciousness was for him. When Locke thought of the mind, he thought of it exclusively as a conscious entity. And that went on for about 100 years until Kant and a number of Germans said, that's actually wrong. There is something else in the mind that's structuring experience. He made it metaphysical, but the Germans started to immediately say, there are unknown selves and processes within us that structure consciousness. And that's really the beginning in the late 18th century, early part of the 19th century, of the notion of an unconscious that's mental. Not an unconscious that's physiological. People already thought about that. But an unconscious that was mental. And that then led, through a number of nooks and crannies, to Sigmund Freud about 80 years later.
Efrat, let me bring you into this. Is there a clear dividing line between the unconscious and the conscious?
Okay, so in order to answer this, I want to go back a little bit and tell you a little bit what interested me in the whole area of the unconscious. As doing years and years of work trying to help patients, I was always struck by this phenomenon of why is it so difficult to change? People really want to. They have insights, and yet all kinds of patterns keep sneaking up on them. Even if we have an intention, and really an intention to do things differently, sometimes we slide into another self state, and lo and behold, we repeat the same patterns. So I thought the more conventional explanations about resistance to change is too scary. We are attached to all kinds of attachment figures like our parents. We don't want to separate from them. All of this may have a place, but I thought there must be something else that really drives, just like you said, drives us and drives a lot of what we do. And lo and behold, we really think that a lot of what goes on under the radar. Like Damasio said, the vast unconscious. Only a few patterns come up to consciousness. So now, I don't know, it's like a wide thing. But to be very, very brief, we all have different self-states, self-systems. Each one of them developed within a particular intersubjective, parental, and otherwise situation. And we learn, and we make interpretation about the world, and we build up an unconscious self-system. But the unconscious doesn't stay unconscious because as creatures, and because the motor area in the brain is very involved with all the other areas, we enact what's in there. So the idea that the unconscious is like a container, like a sealed off place for wishes that are not fulfilled, for all kinds of traumas and memories we can't remember because they're too scary, or stuff that was rejected. We don't think like that anymore, at least in a cognitive sense and in other senses, right? Because these patterns are all over the brain. And
So Heather,
Yeah.
let me bring you into this
Yeah.
from the neuroscience perspective. Is there a clear dividing line between the conscious and the unconscious?
Yeah, so I'm interested in sort of, first we have to operationalize it, and like how do you, definition is really important. And so, the most we can say about what is consciousness is first person subjective experience. Only I know about my own consciousness. I assume you are, but I don't know you are. And so it's this very subjective first person experience. So when you're doing things in a lab, like asking people, you basically have to ask people, did you see it or did you not see it? It's self-report. The unconscious is, I think we put a lot of things into this big basket that we call the unconscious. I'd like to maybe divide it into 4 different types. You have the unconscious is stuff that is happening, in the room behind me that I just have no awareness of. I'm unconscious of it, right? My brain isn't even processing that information. Then you have, people who are unconscious when the sort of battery power system of the brain is out. These subcortical areas that kind of infuse the brain with neurotransmitters and make it be awake and alive. When someone's in a coma or under anesthesia, that level of unconscious is sort of a wakefulness. You're not really awake. Then you have the fully awake brain intact, and then you have certain things that the brain is processing that it's not aware of, versus things that it is aware of. And that's another type of unconscious. So things that you're fully awake, it's coming into your brain, it's being processed, you're just not having subjective awareness of it. And then of that, you have what we sort of call the cold unconscious, did you see it versus did you not? And then the kind of more dynamic, warm unconscious, which is emotive and has to do with, memories and repression and the rest of it. That's sort of the really juicy bit that psychoanalysis is involved with. So I think, when you talk about the unconscious, it's not this one uniform thing. But if you're talking about what is the brain processing that we're not aware of versus what it's processing that we are aware of, there are some distinctions we can start to make in terms of looking at brain function, where we can sort of predict whether a person's going to have subjective experience of that information or it's going to be being processed in the brain outside of awareness.
So partly what you're saying is there will always be certain brain functions that remain unconscious. They will never come to conscious awareness.
Yes, if I may. I mean, that's why I think it's good to talk about unconscious processes rather than the unconscious, because it's exactly right. The unconscious is made up of all brain processes that are going at the same time, and they're there. But I don't think there's a particular system that's responsible, or there's a particular area, or
So there's a couple of theories, basically. Ultimately, once we have a full theory of the neural basis of consciousness, can we know whether something is conscious or not? There are a couple of theories. One says that you need to have feedback loops from prefrontal cortex or thalamocortical loops,
Yeah.
so basically going from subcortical, information going from the subcortical
right.
areas to the cortex and back, and that you need these reverberating loops to have conscious experience. And that so
That's
if you
right.
were to process something, let's say visually, unconsciously, you'd activate primary visual cortex. As it becomes more into your awareness, you start to activate higher level areas in the brain that process the information more sort of deeply or evaluate it more, and that comes into conscious experience. So it's not a place in the brain, it's a process, and it has to do with systems and networks.
So there are several different ways we can talk about the unconscious. One is sort of the science of it, or the neuroscience of it. The other is the unconscious as an idea. And George, you were starting to take us to the history. We got up to Freud. And then, so are we still dealing with Freud's definition of the unconscious?
Well, look, you can pick up on some of the comments that my colleagues have made, because in a way you get to Freud and there's this huge problem. The problem is epistemological. It's so hard to know consciousness because that's based on self-report. You ask someone. They can lie to you. They cannot be very aware. Okay, that's one level of difficulty. Now we're talking about things that by definition they will not be aware of, and we're going to count on self-report to understand it. That's mostly been the way. Even in the, and you could correct me if I'm wrong, in the cognitive neurosciences, you need to rely on that internal report. So people have to be very clever, and I think this is actually a really interesting thing that one can use in one's everyday life. Freud was very clever. How do you notice that there's an unconscious process? Well, you notice it by its impact, its weird impact on consciousness. And if you can start thinking about some of the weird things that happen in consciousness, you can start to infer backwards. Now, inferring backwards ain't knowing, but you can try to infer backwards as to what might be happening. So this is when he started to look at these things that most people just ignore in normal intercourse, normal social conversation. Slips of the tongue, right? Jokes that gonna land badly. You know, this is the best man speech that really goes badly. Dreams. And a big one that he started to look at was the way that we mold interaction between two people through what he called transference. These were all of these things to hold on to try to figure out this thing that's so dark and so difficult. What's happening, not in consciousness, we already have trouble with that, but in the unconscious. And it allows you to start to think in a richer way about your own inner life.
But if I may add, it's not just about the inner life, right? Because all these unconscious systems, right, they have to be enacted outside. So one of the way to identify, and we can do it all through ourselves, is really to identify repeated patterns that we just don't like. And in this way, like the repetition compulsion, which is a Freud concept, which is very helpful, the return of the repressed, right? And he was right about that too, because those patterns keep coming up in an automatic, unaware way. And I think I do want to emphasize the automatic nature of these patterns. We just find ourselves in them. So I think in addition to questioning, we observe, at least with patients and with ourselves. It's not just we all are in some ways, right? And we want to do better. So we can see from behavior, and this is why transference is so important, because
Yes.
this is the enacted unconscious pattern.
So just to pick up the historical thread here and to bring this up to the present, of course, a lot has happened since
Yes.
since Freud. I mean,
Right.
he came up with his theory more than a century ago. We have neuroscience since then. We know a lot about what works in psychotherapy. This is a huge question, but if we can boil it down, I mean, what did Freud get right and what did he get wrong in terms of sort of framing the whole notion of the unconscious?
Okay.
I mean, I wrote a 600-page book about it. Man,
That's
so
right.
I'm just going to pass.
That's, okay, so I will take a crack on it. It's not, it's just, again, I think the idea of the repressed is something that I think is very interesting, because what does it mean? It means that there's some little homonucleus inside that directs what stays out, what goes in, what we remember, what we don't remember. Now we know there's no such system. There's no little person there that directs us, consciously or unconsciously. So I think this was one of the bigger problems for cognitive scientists in terms of the unconscious. And also, if we think of the unconscious in terms of processes, it's not delineated events or one memory that is stuck there and is waiting to be unearthed in psychoanalysis and it will solve all my problems. It doesn't usually happen that way.
So on this topic, I did a very extensive review of the neuroscience literature. So most people in cognitive neuroscience aren't really setting out, consciously at least, to investigate psychoanalytic ideas. But some are doing it without even knowing it. And so I went through a lot of the literature and wrote this review on what we're starting to glean from our understanding in basic cognitive neuroscience research about classic psychoanalytic ideas.
Right.
And what the evidence, at least from what I could glean, is that things like suppression, repression, dissociation, we are finding neural correlates to that phenomenon.
Suppression especially.
So you'll have, let's say somebody suppresses a memory, you'll have increased activation of a part of the brain called the dorsolateral prefrontal cortex, which will downregulate a memory area of the brain, the hippocampus. And you can clearly see this when somebody is actively trying to push a memory
right.
away. And what's really interesting is some people say, well, you get the white bear effect. If you say don't think of a white bear, or that's what you'll think of. But they had a really great strategy in this where they said they learned word pairs and they said don't think of the word that goes with this word. And so it was this one-step removal that people were able to actually not remember. And when you gave them a memory test later, they actually did worse on the words that they were told to suppress. And you
that's
could
right.
see a
Very
pattern
true.
there. So these kinds of experiments, the same thing with dissociation. Repression is harder to get at
Yes.
because repression, as you were saying, it happens automatically. You can't just say, okay,
That's right.
repress now,
That's
But there were some studies which got at it quite subtly and interestingly, examples of where we can show people things subliminally, where we mask it using certain techniques. And we can see where their attention goes. And for example, this wasn't my study, this was a study done by another group, but they had naked women and naked men presented subliminally. And then you do these tests where you can see where a person was attending to. And what they found is they gave it to heterosexual men and women and homosexual men. And they found that, sure enough, the heterosexual women would more unconsciously attend to the naked man image, and the heterosexual men would unconsciously attend to the naked woman. But the heterosexual men would avert their attention from the naked man. Unconsciously, this would happen. So this was sort of ways at getting at, and what's the neural basis of this sort of what you might call repression of homosexual desires. But obviously they're not perfect.
Yeah.
They're difficult to get to. But I think these kinds of things at least we can start to test experimentally. Some of Freud's other concepts of I don't know, the Oedipal complex, or when he got into the more what was it, the monotheism and that kind of stuff is harder to actually look at experimentally. So, but I think we can start to investigate these ideas.
George?
Yeah, and I think that actually is wrapped around a very big idea that Freud was right about, and it's a weird idea, because what he actually postulated was that the mind, in some way, is self-regulating. Now, he did this when he was surrounded by mechanistic models of machines and clanking gears and things like that, and souls. He said the mind actually sought out to protect itself from overstimulation. That was the basic idea for the idea of defense. So there were two ideas about the unconscious that the Freudians had. One was descriptive. Descriptive just meant like it's a jungle out there. Your attention is focused on whatever it's focused on, but if I say, hey, think about what happened when you were 5, you can look at that part of the jungle or that part of the jungle or that. That's the descriptive unconscious. But he postulated this other thing called the dynamic unconscious, where there was a barrier to bringing it to consciousness. You couldn't just focus yourself there. And this is the beginning, as you know, you just heard there are all sorts of different manifestations of it. Some of it will end up being right, some of it will end up being not so perfect or maybe even wrong. But the general idea is that we have the capacity to self-regulate and protect a kind of internal homeostasis. That's a fascinating
Yeah.
idea, and it was quite original at the time.
Which, by the way, is totally supported by evolution, because the organism, every organism, even the amoeba, the most important function is to protect. And yeah, if you shine a light on the amoeba, they will skirt away. So yes, there is an innate, they come from all kinds of unconscious, again, processes. There's an innate need to come back to homeostasis. And this is really very true.
When we talk about the mind, is that another way of talking about the self?
The brain.
Well, I'm talking about the mind here, and because I mean, with this word has come up, and then I guess I'm interested in this notion or this question of whether we each have some sense of an individual self, and what goes into that is presumably that would be some combination of the unconscious and the conscious, right?
Yes.
Well, okay, so there's a very specific history to that. So it's weird to think that those words actually started at a certain time, but they did, because they started with John Locke. And John Locke puts forward a mind that's not the soul. He says there's a material thing called the mind, and it has lots of memories. Over time, if you remember those things, he calls that a self. Internal memory at any one time he calls consciousness. I mean, he is laying the foundation for not just the political world that we live in, but the psychological world that we live in. And so that's his definition of what the difference is between a self, which is memories over time, and the mind. There's a problem, though, that people immediately say, wait, the self is really memories over time? Like, what's going to happen with unconscious experience? What's going to happen with all this stuff that we don't fully process, which, you know, came up as a critique of him rather quickly. Actually, by 1750, people were saying, there are all sorts of things happening to us that we don't remember, and they're somehow part of who we are.
I mean, I think the mind and self are different. The self is a construct, I think, of the brain/mind. I mean, I think mind-brain is sort of one and the same. The self is a construct, and that can be changed. So it's made up of memories of this, you know, continuity that we have of this image of this entity that we are, but it can change. We have, you know, patients with brain lesions or with, you know, dissociative disorders where they lose their sense of self. So it's really a construct that's very vulnerable to manipulation, whereas the mind is just this I guess maybe the product of the brain, which is also malleable to when there's brain damage. You know, the way your mind works will change.
Let me pursue this a little bit. Do any of you think we have such a thing as a true self? Something that's essential about us?
Yeah, that's a really interesting question, and I'm sure the history of it is very interesting. I can only start with Winnicott, right? That talked about the true self and then a false self. But I think essentially, we are a whole self. And within that whole self, we have self-states. Whether we are aware of them or not, they're still part of us. So when a patient comes and says, I just did something good, but it's not really me because I usually don't succeed. I mean, and you hear these things. No, that good was also part. It's only very weak. And the other narrative of not doing so well is much stronger. But within that big umbrella of a self, there are self-states. And those self-states are on a continuum between unconscious and conscious, I think. Yeah.
Yeah, my answer would be that the thing that mesmerized people, the thing that they couldn't actually, I was unconscious because I'm about to go to Mesmer. The thing that really captured people was not how unstable the self was, but how stable it was. That we would go to sleep and wake up in the morning and be the same person.
Yep.
Was the philosophical problem that no one could quite understand. How did that happen? You wake up in this buzzing world, but you're the same person that went to sleep. That having been said, as people start to experiment with things like hypnosis, and this starts in the late 18th century, they start to come to this weird encounter with unconscious selves. So this notion of there being an essential true self, which before was exactly what Locke was trying to support, gets exploded by these experiences of people who have brain damage and changed selves, who have hypnotic states where they seem to summon up a completely different self. And this becomes the kind of froth that late 19th century spiritualists and psychologists and psychiatrists try to figure out. And it's a very rich history at this point because people come up with a lot of different ideas.
I think there's this idea of we have core beliefs. That is sort of what some people call as their core. But the idea that there's this self that's not changing, I don't agree with. I think that it's constantly changing. The self that you are when you're, a parent with your child is different than the self that you are at work or whatever. We're constantly changing these states, and also, I like to think of the self as like the personality. It's how we tend to behave in different situations. These behavioral tendencies that kind of really make up our self, at least to other people, and how we behave in different situations is how we then start to identify ourselves. But personality, temperament tends to remain pretty stable across the lifespan, but certain personality traits can change. And this idea that or else what would psychotherapy? What would be the purpose of it if we can't change these repetitive patterns that are driving us?
It is hard because at a certain point, those patterns of different self states, they get a life of their own, and they just get triggered from all this reservoir in the subcortical areas, and they don't even let the prefrontal cortex, right? Because there's always a fight between the prefrontal cortex and the subcortical areas. The subcortical areas about automaticity, unlike Mark Solms, and really enacting stuff. The prefrontal cortex says, hey, wait a minute, do I really have to do this right now, insult this person? So the balance really is between those two areas, the subcortical and the cortical, and it's hard work because the brain is about conserving energy. It just wants to repeat itself. To conserve energy, it doesn't want to learn new things necessarily. I'm talking very generally. And it doesn't want to put a lot of effort. So we really have to put effort, and a lot of this effort is through mindfulness, right? I don't know if this is what you have in mind. Really recruiting the prefrontal cortex to become more mindful.
Well, let's talk about that. So, sort of the question you're all raising is, so how much can we change these unconscious impulses? Which, and the larger question is, how much can we access this unconscious part of our minds? How do you sort that out?
Okay, so I think one of the best ways is psychotherapy and psychoanalysis. I'm not just saying it. It's just because there's really a place where somebody is being themselves in some very fundamental, essential way. And whoever they are, and they enact very similar things to what they do outside. So it's a combination. It's very interesting about the free association, for example, or slip of tongue. Do they really get to the heart of the unconscious, you think?
Does the slip by itself get to
free association?
Free association was a brilliant technique because what it said is, I'm going to do my best, and it's a ruse. It's impossible, of course, to not make me ask you, what are you thinking now? The imperative is going to be for you to try to do everything you can to foreground and make empirical internal experience as it's expressed. Is it really a record of internal experience? Of course not. But it's an attempt to, make a pragmatic strategy that asks the person, tell me everything that you think. Not the things that you don't censor, don't not say the weird things, every weird thing, everything. And then, of course, the great challenge is to look for the ruptures in that.
Yeah.
You're actually interested in where the person fails to free associate, because for Freud, that was the moment
That's
of
right.
something unconscious
So interesting.
interrupting and disrupting this otherwise pattern of free association.
Yeah.
So the moments of unfreedom I think it's a very powerful method. Does it work with everybody? No.
No. The,
So
the
from-
problem with it, yeah. sorry.
So from the therapeutic perspective, how important is it to make the unconscious conscious?
It's very important because, first, it's there. My thing is that the unconscious, not in terms of content, I do not remember my 4th year or my 5th birthday, or we don't remember those distinct memories, right? And especially because the first few years we don't have a hippocampus that records those memories. They're not there, maybe not. But what we do have are those patterns that are based on the affects that I was feeling, interpretations as a child I gave to all kinds of events, self-doubts and very negative feelings. Because think of a young child and they feel very upset. The interpretation most likely will be something is wrong with me, right? And from there, we get to a narrative, okay, something is wrong with me, I'm not good, I'm not lovable, whatever direction they take. It's really important because those patterns then continue. They become part of the self, if you want.
Heather?
From sort of a neural perspective, and it was alluded to before, there's these two systems, right? You have these subcortical areas that are kind of our basal drives, for immediate pleasure, avoidance of pain. They're kind of working outside of awareness. You have the prefrontal cortex, which is kind of thinking about the future consequences of your actions and, what should I do this behavior or not? Okay, so I want to rape that person, but you know what, maybe that's not such a good idea, and then you have this balance. Now when these two systems are out of balance, that's when you get impulse control problems, people going for that basic drive of immediate pleasure despite the consequences, when you either have a lesion to the prefrontal cortex or poor connectivity between these two systems. But when you're suppressing, when you're repressing, when you're keeping memories at bay, or when these unconscious processes are allowed to just go on without any self-reflection, you're not really activating parts of the prefrontal cortex. So I think some of the idea with how do you get to the unconscious is you got to shut down the prefrontal cortex, which is normally suppressing it and keeping it at bay. Now, how can we do that? Techniques like hypnosis, certain types of meditation. During dreams, your prefrontal cortex is deactivated. On certain drugs, alcohol, right? In vino veritas is you turn down the prefrontal cortex. It allows for these things that are normally going on behind the scenes to come to the surface. So that being said, one thing that I'm interested in is looking at people who are being spontaneously creative during improvisation. When you actually, there's some neuroimaging work now that shows when you're in these improv states, whether it's like doing jazz improv or freestyle rap or whatever, you have decreased activation of the dorsolateral prefrontal cortex, the part that was active when you were suppressing, and you have increased activation of other parts like the medial prefrontal cortex, but it's allowing the generation of ideas to come from within. So when you remove that suppression of the prefrontal cortex, you can bring these things to the surface. Now, why would that be therapeutic? From a neural perspective, one idea is that you are now allowing the brain to kind of form new connections. So you normally have this sort of, let's say it's a repressed memory that's acting behind the scenes and causing you to act out in a specific pattern of behavior. If you can bring it to the surface and reinterpret it somehow, or associate it with a new emotion or feeling, or somehow that can maybe break the pattern by creating new neural pathways. But you can only do that when you have it brought to consciousness and you can re-manipulate it somehow with the prefrontal cortex.
Yes, because we know exactly that. We know that when we remember things, the protein of that lay down the memory change, and the memory is subject to change. So when you remember something that you thought of, I don't know, a week ago, you don't remember the original memory, you remember the memory of the memory. And this is really important for therapy, because if you get those patterns up, you contextualize them, right? You're not 4-year-olds anymore, you're not at the mercy of your parents, whatever it is that we know from the patient's history. But I think one of the most brilliant things, talk back about Freud, is the transference. Because the transference basically is how we are in relationships. It's not that I transfer my father or my mother, it's how I am in a relationship. And we all have transferences to our significant others. It's just part of the intersubjective interaction. The brain will do the way we interact, inevitably. So when we get in therapy and we see how a person is with us, as therapists, is a real, very rich field to catch the thing.
Now, we've been talking a lot about the tradition of psychoanalysis in particular, coming down from Freud. Of course, there are many other therapeutic techniques. Cognitive behavioral therapy is very common right now. Can we sort of weigh pros and cons of some of these different therapeutic techniques and in terms of effectiveness? Anyone
There are
want
like 450
Different therapeutic
I researched it
techniques.
For my book, yeah, 450 is just about of the therapeutic techniques. So what it means that we really want to find that golden road to change. This is what therapists want to find. It's not, and also I think because there's so many, it means that it's not so easy. I think the recent development of CBT, DBT, techniques that are much more focused on symptoms and mindfulness. I think the thread is mindfulness to the new techniques.
Well, I'm not an expert on this empirical data, but my reading of it is that everyone wins. That they do these studies with psychodynamic psychotherapy,
That's right.
IPT, CBT, and pharmacology, and they all work.
Well,
what are we supposed to do with that?
What we need to do with it, really, and it's the same thing about your question of how important is it to make the unconscious conscious, we need to start specifying we are vastly similar as human beings and vastly different. So we need to start specifying this with this small group. That with one of the grave problems with psychological theorizing is people they start with a small group and they end up making a theory about everything. And then it really dilutes the actual power of the theory. So I would say we need to get a lot better figuring out, for instance, the Hitchcock movie thing of making the unconscious conscious, that's for very, very few people. It's not nobody, but it's very, very few. The work in the transference, the slow slogging, make the unconscious conscious. Do it again, do it again, do it again. After the 400th time, it's change. You know, it's not the Hitchcock thing of I realize.
That's right.
That's much more common, and there's certain groups where you know what you're in for. That's what you're going to have to do. CBT is going to work very well in certain communities, but some groups of people it ain't working. So we need to be much better about being understanding about how the
very
different modalities and medication I would add as well.
Yeah,
So what are we
exactly.
supposed to do?
It's not your job; it's our job.
No, but it's like I'm like one is plagued by anxiety, by negative thoughts. Who am I
right.
supposed to see?
Well, I think
The good news is it doesn't matter.
whoever you
Not
see.
so sure. I am not so sure. You don't want 10 years of analysis. That I think I can say.
I think there are certain, at least what the study show, and there has been a lot of research out there about different techniques used on different types of disorders or problems. And, it's very complex because there are different interactions. There are certain therapies that work better for certain types of things. Exposure therapy can work very good for phobias, for example. And, you can go 10 years of psychoanalysis, but you know what? We can probably
right.
cure you with your phobia much quicker in
right.
using these techniques. So certain techniques work better for certain problems, certain combinations of things. There's studies with depression that show, yes, drugs work, they just have some effects, and psychotherapy works, but actually when you put them together, you can get this synergistic effect and it can get even better. But it's every individual is different. Some drugs work on some people great and not on the next person. So I think ultimately when we get to understanding the underlying genetics and how the genes are forming how our brain is functioning, and we can map that out in individuals, we'll come up with more targeted treatments, both psychopharmacological and with psychotherapy.
Yeah,
But it's going to
that's
take a
exactly.
while.
Because even though, you trace the development of the psychoanalytic thinking, right? Even though it's already, 100 and some years, right? It's still really at the beginning because how we are kind of latecomers to the brain because of the new tools that we can look into it, right? So I think now we need quite a long time to really take our time, look into the brain, do studies like you are doing, and come up with a better understanding about this connection between the brain and mind.
So who would be the best candidates for psychoanalysis, for that kind of very in-depth, long kind of treatment?
Okay. Depends what the person wants. If they want to come 3, 4 times a week and just talk and talk and talk about their parents, we as a silent analyst, okay, that's a privilege. They can really, hear themselves talk. It's fine. But I think there's something more active needs to take place, and especially when we do all these, when we have some of the studies, that the brain responds to attention, for example. Put attention on something. It responds to mindfulness, recruiting the prefrontal cortex. And it can be done within the umbrella of psychoanalysis. It's just that I think when somebody is just using the cognitive brain just to talk, just the verbal, I don't think it works, because we can rationalize anything. You know the joke, I mean, the right brain does something, the left brain explains it. And we can explain and rationalize and do whatever we want, but if we just engage the cognitive, the affective has to be there, the affective.
George, do you want to weigh in?
Yeah, I do have to weigh in. So I don't think that psychoanalysis is just engaging the cognitive. A good psychoanalysis should be a very emotional experience. Look, it's at the price point where it should be, which is to say it's a treatment that people go to after they've tried a lot of other things that haven't worked for them. And they should be correctly screened for the right kinds of problems. But I would say a lot of different people with very serious character disorders who have tried medication, who have tried mindfulness, who have tried CBT, and this is the Canadian experience, those are the people who end up going to psychoanalysis. And you know what? A lot of them get help.
Yeah.
So I think that, it's a lot of time. It's no one really does it like the Partisan Review crowd used to do it in the 50s. Like, no one's going because it's cool. It's expensive and it's really time consuming. But it is, I think, effective for that small group of people.
I also think that there's something that cuts across all these different types of therapies, and is that there's this unexplained element that in terms of the treatment, it's just the relationship with somebody that is having these effects. Whether you're doing CBT, DBT, psychoanalysis, some say it's up to 70% of the therapy is independent of the actual particular technique.
Yeah.
It's the
Right.
relationship you're having.
That's
So
very
if you
true.
have a really good CBT, let's say, therapist, but who is forming that alliance with you and making those connections, whether they're setting out consciously to do it or not, that can be just as helpful to a patient as what they're getting from psychoanalysis. So there's a lot that's going on independent of the actual technique, which is just about that therapeutic alliance and having someone there who's empathetic and you can, feel connected with, and that there's something to that. And we can't quite quantify it, but I think that cuts across. So I think psychoanalysis is going to be helpful to a lot of people just for that reason alone.
Why are some people better able to make changes? They're stuck in some sort of a negative pattern, and they go to therapy and they really change their lives, and other people they keep going back and they're just stuck and they can never
Yes.
change. What's going on
I
there?
think from a neurological point of view, we talked about this balance between this and this, the subcortical and the cortical, and people talk about how flexible that balance can be. I mean, if there's no flexibility, if the prefrontal cortex cannot engage the lower parts, a person can be very inflexible.
Are you saying it's the way certain brains are
Yes.
wired, as
I think-
opposed to
yes.
it's more of a
It's
I don't
the
know,
wiring. And I'm not saying the wiring cannot be changed. Of course it can. It can. But I think this flexible, inflexible continuum exists. And we see it in every day in patients. I mean, you see it.
Yeah, we do see flexibility and inflexibility is the big problem. I'm not sure it's a neural problem. I don't think we know that. I think we know that phenomenologically, there are certain people who have the same problem, and some people make rapid change and some people don't. We're not so good at figuring out why, and I don't think we have any neural basis for that, on the understanding of that. But it is a huge problem, and it's one, frankly, that psychoanalysts have wrestled with without any kind of traction on. It's a kind of clinical wisdom thing, figure it out. Like, it's very difficult.
I think that even though we don't know the exact mechanisms yet, I do think that we're born with certain genetic predispositions. I mean, you can predict, you can see the temperament of a baby, and really you can make predictions about
Yes.
how their personality is going to be the rest of their lives. So there are genetic predispositions, and I often say, like with patients, let's say if they come in with severe anxiety disorders or obsessive compulsive disorder, and there's a genetic component to that. We do research studies that show that if there's lineage there from hereditary and the like. So with therapy, I say, you know what, you're born to you're never going to be the coolest guy in the room, right? You're never going to be the most chilled out, relaxed person, but we can get you to a place where you're not at the top level of your anxiety range, but your range might always be here, whereas another person's range is always here. But we can get you to the bottom of your range within your biological constraints. So I think there is room for change, but there's also certain limitations based on, if you want to say how we're wired or how our genetic predispositions are.
Yeah.
Are there still some fundamental mysteries, and I don't know if this is specifically a science question about how the unconscious works, or do we kind of more or less know the basic outlines and it's just working out the details?
We know the basic outlines, and the details we don't. I mean, in some ways, but there's a lot of work, and especially when you do all this masked stimulation, but I think most of what we get is really through seeing patients. This is the most, I think, educating process, to see how people struggle with those patterns and how difficult it is for them to change. Some more than others, of course. And there's, like everything else, everything is on a curve. Some very fast, most of us are somewhere in between, and some don't. And this, I think, is a fascinating thing, because even insight, even like real wishes for something else, it's not that easy. And the question is why? Why it's not easier to decide I don't want to feel anxious next time, and I still do, like the body, the body, brain, mind, all one unit takes over.
So for Heather and George, big questions still to be answered about the unconscious. What would you say are some of the biggest?
Pretty much everything. I mean, it depends on what you mean by knowledge. I think we have a lot of pragmatic knowledge from therapeutic encounters. I count on it every day. That's not scientific knowledge that's universal and reliable and valid. We have interesting, fascinating new kind of cognitive neuroscience models that are trying to work with both mental and neural functions together. We don't know how to put those together. No one has a model for top-down regulation that shows how minds interact with brains. We have a way of reducing minds to brains, but the critical question for us is not just that. The tougher one is, how do minds make us do things? How do we have intention? We have no idea about that. How do we have intention that's unconscious? We have double no idea about that.
Yeah, I would agree. I mean, I think that there's still this great mystery of what's the neural basis of consciousness, like the things that we're just blatantly aware of. I process seeing that exit sign and the edges of it and the color is red, and how my brain is even making me consciously aware of that. There's still limited knowledge. There's some knowledge about how the visual system works, but why do we have that subjective experience is a question that some people say could never be answered. So that's just in the realm of conscious experience where people can report upon. Then you start getting into this realm of where people don't even know what's going on in there, and how do you track that to what's happening in the brain becomes even more difficult. So I think there's huge questions there. But that being said, we know a lot more than we did in even Freud's time. Just in terms of concepts of of free will, and how we can measure processes that are going on in the brain before we're even consciously aware of a decision we're going to make. And there's some really interesting things we can start to look at now. So we're not totally in the dark, but there is a huge amount that's left. I mean, we're nowhere near really fully understanding it.
I want to go to the audience in just a minute here, and so get ready for your questions. But before I do that, I'm wondering personally, for each of you, I mean, you all have been studying these questions. You've thought about the nature of the unconscious and, what a healthy life is. And I'm wondering, through your study, whether you've done anything differently in your own lives. I mean, have you changed anything based on what you've learned about the way our brains and minds work? Efrat?
I learned the importance of slowing down rather than jumping into something because I have a feeling or an impulse or something. Slowing down to really think of it for a second. So that is engaging again, hopefully now automatically, a little mindful process. I really do think that one of the most helpful things is mindfulness. People who meditate have such a slowing down process. They don't drown in negative self-states. I mean, the problem with those unconscious negative states is that they take over, and for a moment, they convince us. The end of the world, I'm anxious, I can't do it. We are so convinced because the experience is inside our skull, so it's very, very convincing. How do we fight it in real time? And some work with patients that I like to do is really even giving homework and teaching them in real time how to engage other systems that they have, not just drown in a particular self-state. This is what I know.
George?
Yeah, I think I agree with some of those things, and I would say it forces you to live with a certain amount of skepticism about your own convictions.
Yeah, that's right.
And that actually is a very healthy thing.
That's
I
right.
mean, it shouldn't mean that you never have a conviction, but it does mean that you worry that there are aspects to the way that you're processing the world that you simply aren't aware of. And so if you live like that, it means that you're pretty open to other people's views, and you're pretty open to questioning your own views. And I think that that's been a great and healthy thing for me to try to wrestle with. And you forget it every day because you
Yeah,
come up
that's
with a
right.
conviction, but you have to keep, in a way, reminding yourself that subjectivity is, by definition, a narrow little beam in the jungle.
That's right.
Heather?
Yeah, I think both issues of control and letting go. So for me, the idea is like saying, you know what, a lot of what I'm doing and the decisions I'm making are being governed by things outside of my control, and sort of accepting that, and that's okay. You know, because a lot of people want to fight it. You know, I have control over everything that I'm doing, and it's like, you know what, I know that much of what I'm doing is being dictated by sort of forces outside of my control, and there's a letting go in that. At the same time, there's this knowledge that I can have greater control over, let's say, my negative tendencies or impulses. And so I think mindfulness is a key, you know, if it comes to just eating healthy or whatever, having a healthy diet. I know that if I'm really thinking about, like, it's the slowing down and taking the time to say, okay, I'm gonna like enjoy this meal, and how does it taste and what does it feel like, and having those experiences to help modulate my behavior, knowing what your tendencies are, your predilections, and then kind of working to help modulate them. And I think that is something I've, you know, consciously have tried to do. Now, that being said, if you talk to my husband right now, who's been living with me the last 9 months, like, that's all gone out the window. And it's been
Glad
so
you're happy with it.
it's been really fascinating to me, though, because I noticed myself, like, it's hormonal, whatever, my body is changing, and I have so much less control over my emotions, and I see that change, and it's like still me, still the same person, but it's amazing how much, you know, you don't have control, and when your hormones change or the way your brain is functioning changes. And I can really relate to some of the patients that I've had with impulse control problems, whereas, you know, before I was so much in control of things, and I can see how your emotions can take over. And having that sort of first-person experience has really been interesting for me. So as much as you know the techniques, putting them into practice, you know, when you don't have the full capacity to do so, it can be very difficult.
But
so
even
it's been
knowing
insightful.
This, right, but even knowing this, that you're under hormonal, emotional, all kinds of sways, even just knowing it, I think, is a lot.
Yeah, it's helpful, because I'll apologize after for. It's true.
Let us go to the audience, and there are a couple of roving mics.
It's not just the neurons and the synapses, it's really what goes into them. The most important element, which we didn't get to, is really the environment, the intersubjective environment in which we all grow, the baby grows, whether it's good, not so good, very bad, all of those relationships, the memories, the affects especially, that are generated go into that unconscious. But other things go into that too, social. Like you can explain Jung's thing by, yes, we do have a social unconscious in a way.
But Jung went way beyond a
Yeah,
social
that's right.
unconscious. He talked about a collective unconscious that goes beyond just an individual brain.
I would agree with you. I would expand your notion of biology, that this is about right now, to include things like mental states, experiences, social and familial experience, et cetera. And then once you start to do that, then you start to encompass mind, brain together.
Yes, that's right.
But Jung had a biological notion. It was Lamarckian heredity at the time. He believed in it. The notion was learned experience was taken in to the mind and could therefore be transmitted biologically to the next generation. So his notion was, and it's a lot like Renaissance notions of God, that all of human history was in each of our unconsciouses, and he predicated it on what he thought was a sound biological idea that turned out to be mostly wrong, which was Lamarckian heredity. What? Well, yeah, I said mostly wrong because I thought of epigenetics.
So it sounds like all of you are saying, to follow up on this question, that even if we have a very thorough mapping of the brain, there are still going to be all kinds of questions about that.
Just 2 points on that. And this very well-known philosopher, he's based now here actually at NYU, Dave Chalmers, came up with the hard problem, the easy problem of consciousness. Easy problem, which is actually not that easy, but if we can map out every neuron that fires, that is directly correlated to every thought, to every experience, every emotion, we would have solved the easy problem of consciousness or even unconscious processes. However, the hard problem, which might never be solved, is why is it that these physical, neurons firing and neurochemicals slushing around will give us subjective experience? We might not be able to ever make that leap of understanding. But the thing is that even if we understood all the biology, we solved the easy problem. People are constantly changing and evolving. There's no state, there's not really a static state of the brain. So an experience can change. Like human behavior is very difficult to predict. Experiences can change the way the brain functions. Then because it's this process that's constantly evolving and changing, even if you knew a person's complete genome and every neuron that fires when they have a particular thought, it might be still difficult to be able to predict human behavior or understand the unconscious.
You know what's interesting about that? The way we affect each other intersubjectively, it's especially true in intergenerational transmission. Now we know it exists. It can be nonverbal, verbal, but we transmit our experiences to our children, grandchildren, and it goes down the generations, especially transmission of trauma. Now one very interesting study in Mount Sinai actually by Rachel Yehuda, right? So if very traumatized rats, thank God they deal with rats, they give birth, and then the offspring, right, and correct me if I'm wrong, they have compromised ability to deal with stress. The pups themselves were not traumatized. It's the mother who was traumatized. So I think this is a very important finding in a way, because it really shows maybe Jung, and I'm not Jungian at all, but maybe he was onto something, some kind of a transmission of some collective experience. Maybe.
That I know Helen Mayberg, and I know her work very well. And we're actually at Mount Sinai doing trials of deep brain stimulation for the treatment of obsessive compulsive disorder, which is otherwise treatment resistant. So it's important to remember this is a last kind of resort treatment where they've tried every psychotherapy, ECT, nothing has worked.
What does that mean, deep brain stimulation?
So basically, it's you go in and it's you kind of think of it as targeted ECT or electric shock therapy. With ECT, it's kind of like something goes wrong in your computer, you just like turn it off and turn it on again, and then somehow it magically works again. You don't really know how. That's kind of what that's like, and there's a lot of side effects. So what Mayberg started doing, and this was originally used for treating movement disorders, is you go in and you implant electrodes. So it's neurosurgery, it's minimally invasive. Patient is awake during the surgery, implants electrodes and stimulates specific, usually subcortical areas of the brain, and it's connected to a wire that's connected to a battery pack implanted in the chest, and you can control the amount of stimulation. You can control, there's 4 different contact points, where you're stimulating and how much. And so with Parkinson's, you see people who have these tremors, and you turn it on and you put it in the sort of motor areas of the brain, the basal ganglia, and their tremors stop. And then this started being used for treating psychiatric illness. Mayberg found that across all neuroimaging studies, there was this one part of the brain that seemed to be related to depression, Brodmann area 25, anterior cingulate. So she decided we're going to put these electrodes in there and see what happens, maybe disrupt the circuit. Yeah. Now, that's a bit of an exaggeration. I mean, it works not all the time. It works not 100%. It's not, there are these extraordinary cases where in the operating room, you turn it on and people will say, oh, it feels like I've won $1 million, and then you shut it off as they're talking and their whole affect goes back down again. It's really amazing to see. But it's not all the time, and it's not in all the cases. And how it actually works, we still don't really know. You know, is it disrupting a faulty network? Is it stimulating something that needs to be stimulated? The exact mechanism, we don't know, and there's a lot of trial and error. And each disorder has different targets, and so it's really complex. But the truth is, if you can hit the right target in the right kind of patient, it can completely change a person's affect.
Right, and the key is the affect. I mean, we're dealing with mood, right? With very depression, for instance. I'm not sure it's not unconscious per se. But I think what it does show is that the importance of subcortical areas for affect, and something is not there's no breaks there. Same with OCD. There's no break that stops the thinking process, and this thing does it. It seems to. I think what the work of Peter Levine and other people, and what you have just indicated, is we bringing back the importance of the body as an entity that cannot be separate from a brain. So there is a lot of work that's being done with body, centering it, feeling it throughout. And I think it's not that we know exactly how it relates to it, but I think we are on the way. And a lot of body work, I think, is very, very effective.
What kind of body work are you talking about?
All right, so maybe let's take the anxious patient who comes and they're so anxious they can't sit still. So a therapist would really anchor them. They would ask them to sit quiet, to see where do they feel the anxiety. A lot of people do feel it in the chest, right, in the solar plexus. It's very, very common. So you trace this anxiety, and then you see how sitting really anchored on the chair affects it. Then they may ask people to free associate to see what comes with that very bad feeling in the chest. But the body still becomes the repository. A lot of people say the body is the repository to so much of the negative feelings we have. So it led to a lot of body work, basically. That's the way I would see it. Right. Conviction is part of that self-state, and a lot of convictions that's what they are, they're conviction. And when they are tied in, I think, to a wider worldview, and especially to negative feelings that go back to one's childhood, I think they're very resistant to change. And then there's the identification with the group, right? The group is so important. You can see, today, you're either a Democrat or Republican, and they're really, but the identification with a group, with a tribe, is really, really strong.
I would recommend work by Jonathan Haidt.
Right.
He's also based here at NYU. He's written a lot about this, about political thinking and how it relates to different personality types. But there are certain personality dispositions that are drawn to certain political ideologies. So, for example, people who tend to be more conservative have usually greater disgust responses. So they're fearful of the other. And which can lead to a certain worldview and adherence to a particular political philosophy. Yeah. So I think people's innate personality dispositions can predispose them towards believing in a certain political ideology. And there have been these connections that have been made. And just people's brains work differently, and there's some neuroimaging work to show that as well. Differences between people who tend to vote more conservative versus those who are more liberal and open-minded. Open-mindedness is a personality trait. I would suggest looking up his work.
Yeah.
Is this another way to talk about implicit bias?
Yeah, I think so. I think that there are these implicit biases as well that are all tied into that. People who are, xenophobic and have this more, and even actually, it turns out that pregnant women tend to be more afraid of the other because of fear of contamination, right? So you become more conservative when you're pregnant, and that's just an evolutionarily adaptive thing. So I think, but to protect from,
sure.
this idea of protecting from germs or the unknown and protect the fetus. So I think that. The biases, but there are these implicit biases, and that can be related to the way people tend to vote.
Mm-hmm. It's a very important question. It has a very, very long history, and actually, it, I think, is the question that in part propelled the invention of the idea of the mind, because what Locke and others were really, really concerned about was religious fanaticism. They saw around them in interregnum time, where there were all these Protestant sects, people speaking directly to God, creating a sect, refusing to abide by the law. And of course, there were decades and decades and decades of inter-Christian warfare, bloodshed everywhere. So his notion was, we can't have a model of knowledge that is about absolute truth, because then one absolute truth goes to war with another absolute truth. We need to have a model that is provisional, so that knowledge is provisional and everything we know is provisional. It's parochial, it's prejudicial, it's about what we learned. And P.S., get in there really early and teach the children
Yes,
well,
exactly.
because that's going to be who they are. So he was very interested in, of course, early education and trying to create rational subjects for liberalism. That was part of his project.
That's amazing, because today I think that's what they're trying to do in schools. Schools have, some schools, mindfulness programs where they really teach among children. You can imagine if a little boy, rather than taking in all this misogynistic attitude, has to think about the plight of the girls. I think this is so important. And when you talk about Locke, it's just amazing, with an amazing mind and person. And
But that raises the question, so if someone, how much can you teach open-mindedness, or is that something that we're basically either wired with or we're not?
I mean, there's studies that are done in babies even, where they can,
Yes.
there's work that's been done by Paul Bloom and his wife, I forget her name now, but at Yale,
Yeah.
at the Child Study Center, where they're looking at infants and they can show that they can perceive things that are unjust or unfair.
Yeah.
They'll prefer like the puppet that was the one that was the giving one versus then the one that was a bully or something.
Yes, yeah.
But they're individual differences. So there's some kids that really, do prefer the nice puppet over the mean one, but there are others who don't care as much. And so I do think there are these innate differences. But like everything, teaching and education can help modify certain behaviors to an extent. So it's not a lost cause, but there's always going to be individual differences amongst people.
but I think it's easy. The second one is easier, is the socialization and the unconscious. I mean, basically what we have in the reservoir there, if you kind of have the image of the vast unconscious, as the Master calls it, as the reservoir of all our experiences, definitely part of those experiences are gender specific. If a girl grows up with an angry father and a very subdued mother, what is her unconscious taking in? She's not going to remember day by day how her father treated her mother, but in that reservoir, the pattern has been set, and either she'll see men as abusive, even when they're not, or she will seek her unconscious, because of the brain likes familiarity, will choose similar people. So yes, the gender is incredibly important, and boys vice versa. And I think one of the ways to explain misogyny is through this reservoir of what goes into the unconscious. And those messages are everywhere, verbal and nonverbal, from TV, social media, everywhere. So, yeah.
And then what I also heard the question was, is there a biological component to this? I mean,
Yes.
essentially
Yes, of course.
is the unconscious gendered biologically?
I don't know.
I mean, there are gender differences. There's differences in hormones and the way even what you're exposed to in utero. They can show that children who are exposed to higher testosterone levels have more
Yeah,
dominant
that's
traits,
right.
and
Yeah.
so there certainly are differences in terms of our underlying neurobiology, and our unconscious is related to our underlying neurobiology. So yes, there will be gender differences in that as well, in addition to the experiences that we have as well, which will mold it.
But just to add to this, let's say if we deal with anxiety, for instance, which I think is one of the biggest organizers of all of us. So if biologically I am born with a higher level of reactivity or hyperarousal, my interpretations of what happens to me and my mother, between me and my mother, are different than the baby who's placid and is okay with whatever happens. So I think, are there any gender differences? Maybe, but I think these biological differences that Heather talks about are really, I think, very significant, especially where it talks about anxiety.
One of the great things that psychoanalysis has done, put out all this theory, probably a good percentage of it is wrong, a good percentage of it is right. But it's kind of everywhere. And what it's done is it's given people a language to name things and to consider whether they're important to them. And that becomes a kind of literacy. You now have a whole array of names and theories about why you're feeling the way you're feeling. And if you live in a community where that's frowned upon, you still can participate in the wider community of the West where this is very common. And I think that's quite liberating for people, that they can come out of a world where maybe this kind of emotional introspection is not supported, but need to in some way engage themselves in a new way and have waiting for them something that wasn't there in like 1850.
Yeah.
You know, you went, if you were French and you in 1850, you went to the church, and if that didn't work, you didn't know what to do. So
That's right.
this is this secular option that we now have to try to make sense and meaning of our internal experience, even when we might come from a family or a social group or
Yes.
a culture where it's not supported.
Yeah. Just to support what you're saying, George, is that there's some studies that show that just naming a feeling or a state reduces our level of the excitation, anxiety. Just name the affect, and it's exactly right. It's so important.
Another important point, I think, is just to always remember that point of like people want to get rid of the negative emotions like they're bad, but to remember that they evolved for a purpose. And negative emotions, right? If we never felt anxiety or sadness, or whatever, that actually would not be adaptive. Anxiety is, to help us deal with potential threats and protect ourselves from that. Or sadness, some say, is to when you're incapacitated to elicit help from others when you need it, to display the sign of I need help. There is. It would be maladaptive to not have the negative emotions, and to remember that. It's important that people you can accept them, and then they become less bad. And we have less anxiety about our anxiety.
By definition, the answer is no, I can't, because by definition, there's a vast amount that remains unconscious for even the most enlightened person. This is a secular model, so we're not talking about like Dante going to heaven. We're talking about a secular model where this is the nature of, maybe the tragic nature of human knowledge. We only can know ourselves so much. So I would say the answer is no.
I have to push you a little bit on this. There must be some people who are more adept at doing this.
But that's a different question. More adept does not know they're unconscious completely.
No, you can't. You really can't, because if we think that the unconscious is formed a lot in the first few years, there is no explicit, there are memories, but not explicit memories. You cannot remember what happened to you when you were 2. You have an idea, something. But I think artists, like Picasso, for instance, I don't know, with his wild attempt to look from underneath the woman's shape, right, and change the face around, maybe Picasso?
I think
Ask his 7 wives.
That's right. But he kept trying. He kept trying. Kept going after that. That's right.
No, I think there's certain people who have better ability to gain access to the unconscious processes, but nevertheless, I mean, so the thing about consciousness is that it has a limited capacity. You can only keep a certain number of items or thoughts in consciousness. But consciousness on the unconscious is virtually limitless. If we were to be consciously aware of everything that was going on in our unconscious, it would be overwhelming. We wouldn't be able to function. It would just be too much.
That's right.
So the idea of a person who's completely consciously aware of what a normal person would be unconscious, it's inconceivable, and it's almost just anatomically not really possible. It's like saying, can I see, if I'm looking this way, my rear end? I don't know. Like, it's not really a possibility from the way my anatomy is.
Oh, can I see how my pancreas is doing his insulin?
Right.
It's the same thing. We can't.
But some people, I think, can get or easier. And artists, I think that's why I think looking at people who are creative and or can maybe have an easier inroad to gaining access to some unconscious processes. But I wouldn't say that they're fully conscious of their unconscious.
We have many more questions that we could handle, but we have no more time. Thank you for all for coming.